Black youths are at a higher risk for depression, anxiety, and other mental health struggles than their non-Black peers. Our guests are sounding the alarm and sharing important ideas for addressing the crisis.
We'll be talking about actually our youngest patient of this series, a 9-year-old girl named Penny, who basically comes to the hospital because she wants to kill herself because of the racism she's experienced from her peers. So it's going to be a heavy story, but basically, we present a narrative, we present the case, just like a normal clinical case conference, so you get all the background and the history and everything.
Dr. Amanda Joy Calhoun is the chief resident at Yale University's Integrated Adult Child Psychiatry program. Dr. Titiana Arma is the chief psychiatry officer and the vice president of behavioral health at Community Health Center. She also serves as president of the Connecticut Psychiatric Society.
Black children ages 5 to 12 have suicide rates that are nearly double that of their white peers right now. And the suicide became the second leading cause of death in Black children ages 10 to 14 as of 2018. And it was around 2017 that I really started to see this and get really alarmed from all of the statistics that were coming in.
This is Conversations on Healthcare.
Well, Dr. Calhoun and Dr. Arma, thank you for joining us on Conversations on Healthcare.
Thank you for having me.
Yeah,
thank you.
That's great. We read, we were taken back by this New York Times headline, which asked, why are more Black kids suicidal? In fact, the suicide rate for Black youth is rising faster than any other racial or ethnic group. I wonder if we can start with asking each of you to provide your perspective on the crisis.
Absolutely. Happy to. And thank you. Thank you for bringing further light to this topic, because it really is such a frightening, a frightening thing that we're seeing. So it's true. I think it's really helpful to understand the gravity of it when you think about the numbers in terms of the ages. So Black children ages 5 to 12 have suicide rates that are nearly double that of their white peers right now. And the suicide became the second leading cause of death in Black children ages 10 to 14 as of 2018. And it was around 2017 that I really started to see this and get really alarmed from all of the statistics that were coming in. And I think there are really a number of things that that are playing a role in contributing to that. One being dealing with this incessant and daily discrimination that wears down on them. And I just want to note that it has both a physical effect as well as a emotional impact. And, I'm sure you've had guests on before talking about the process of weathering, but they've been able to see and document that children who are dealing with more racial discrimination had really early levels of markers of this weathering effect, where the DNA is actually getting beat up. And we have already seen that has a huge impact on our mortality. So at very young ages, we're already seeing that it's having a huge impact. We're hearing it not just physically, but also emotionally. And in addition to that, it's not just the interpersonal discrimination. There's also an environmental level of discrimination that's going on. These children have less access to green spaces, less access to healthful foods. They have a fear of even going outside. And I'm not talking about children who are, who live in what we would call the hood, right? Who are living in places that are just so economically disadvantaged. I'm even talking about children who are coming from affluent families, people who are children who have a doctor for a mother and a businessman for a father. I have one child who I know, a teen, he didn't want to learn how to drive. This is like the rite of passage, right? In suburban Connecticut. He didn't want to learn how to drive because he wanted to stay alive. He was fearful of even learning how to drive. So just thinking about the wear and tear of that on the emotional well-being. And then there's other things like once you realize that there's a problem, being able to get care that's culturally humble, care from someone who respects you, who's going to have high expectations for you, and racially concordant care as well. So there's plenty more. I'm going to stop because I know Dr. Calhoun has a lot to say as well.
Yeah, great. Thank you.
I mean, I echo all the things that Dr. Arma is saying. And I also have to say that I just feel so honored to be speaking with Dr. Arma because she is just a close mentor of mine. And so I just feel really honored to be here today. I echo all the things she's saying. So I mostly see kids right now. I see a lot of kids. I see very young kids, and we know that there's mounting evidence that shows that experiences of anti-Black racism affect children before they're even born. So we know in utero, if Black women, mothers, are reporting experiences of anti-Black racism, so racial discrimination, et cetera, they're more likely to have babies that have lower birth weight. And when we think about what that means in psychiatry and in mental health, we know that lower birth weight is also tied to greater risk of mental health issues later on in childhood and even beyond in adulthood. There have also been studies that have shown that maternal experiences of anti-Black racism even lead to negative emotionality in the first year of life. So we're talking about effects and strikes against Black children before they're even born. And then when you look at very young children, a lot of whom I see, studies are coming out that anti-Black racist beliefs start to become ingrained by the age of 4 years old. Some experts would argue younger. So Black children are going to preschool, and they are already experiencing racism from white peers, from non-Black peers who are ingesting this racial hierarchy that we have in this country. They're also experiencing racism from their teachers. I mean, we know that it's not just the school to prison pipeline, it's the preschool to prison pipeline, that Black children are more likely to be suspended, arrested in school, and when we look at child psychiatry, unfortunately, that excessive punishment continues. I was a co-author on a recent study that came out in JAMA Pediatrics that showed, and this was in New England, across multiple emergency departments, that Black children were the most likely to be physically restrained in emergency departments, the most likely. And so when we think about all of these different things, which is what Dr. Arma brought up, not only are they experiencing racism out in the world, but then they're coming to us. They're coming to seek mental health care, and they're being inappropriately and excessively restrained. They're being given care that is not optimal, that is not the standard of care. Of course, they're going to have increasing suicidality. Of course, they're going to have poor mental health outcomes. And so the data is not at all surprising to me, but I'm just glad that it's getting out there and that people are talking about it.
Could I just say, Amanda's so spot on, because you have people who are traumatized getting traumatized even further by the people who are supposed to help them. So it just.
Mm-hmm. Yeah. Well, I want to thank you both for the powerful framing that you gave to that, and the fact that it starts almost from birth. And I think you'd probably both agree with me. We can imagine actually probably some epigenetic trauma from their parents' experiences as well that come to play here, and obviously so important that we do something about it. And along those lines, Dr. Calhoun, I understand you organized an event that brought together over 300 healthcare providers for a Black youth mental health clinical case conference. Clinical case conferences can be very powerful, and I'd like you to tell us about the clinical case that you presented and the discussion that followed.
Sure, I would love to. So, I really wanted to create a space in medicine to talk about these issues that Dr. Arma and I have mentioned, because, in a typical clinical case conference, we mostly focus on the problematic behavior of patients, or we talk about, a strange side effect that, that happened, or, we found out a new medicine was helpful, but usually clinical case conference series, none that I have seen or heard of, have ever talked about what if one of the primary problems that has led to the lapses in care of this Black child is the medical racism of the team, the racist behavior of the medical team. And so you can't talk about those cases, even though they're happening all over the country, because if you present that case, then you often get retaliated against. There's a lot of fear, rightfully so, about coming forward. And so what I chose to do is I interviewed Black mental health care professionals from around the country. And I said, tell me about your case, an anonymized case, obviously, where you felt like the racist behavior of the medical team led to poor care. And I chose 6 that I then wrote out into a case presentation and also a narrative. So I basically infused the feelings and the emotions that the mental health professional was telling me and wrote it into a story. So they happen every month from January to June. So we've had 3 and we'll have 3 more. Our next one is actually next week, April 10th. And we'll be talking about actually our youngest patient of this series, a 9-year-old girl named Penny, who basically comes to the hospital because she wants to kill herself because of the racism she's experienced from her peers. So it's going to be a heavy story, but basically, we present a narrative, we present the case, just like a normal clinical case conference. So you get all the background and the history and everything. It concludes with the narrative. And then we have an expert discussant panel that comes in and weighs in on the case, and we engage the audience. So I'm really excited about it. I hope that I know some people from CHC have already been there. And also Dr. Arma will be an expert discussant in May. So stay tuned for that. But I would love for people to attend. And it's actually open to people, even if they have no healthcare background. So a lot of people have attended who are just, mothers, friends, teachers who really want to understand what is happening and how do we form solutions to fight against it.
Well, I want to just pull the thread on that because Dr. Calhoun, not only you are a leader in the mental health area, but you're also a trendsetter. Because the case conference series is, as you just noted, is open to anyone. And you really don't need to be a healthcare provider. I think it's so powerful to bring these groups together. And really, each presentation gets delivered in a narrative style. And again, not using clinical language. And Margaret and I know, as part of the community health center world, that the majority of our board of directors are our patients. And so, get rid of all the other language and, acronyms that you're using. Just talk to people directly. And so we say bravo. And tell us why you made this choice.
So, similar to what you said, let's get rid of all the jargon, and I didn't want to continue just sort of saying the same thing to a bunch of psychiatrists. I mean, I love psychiatry. I like psychiatrists. That's great. And, I've done academic
Some of my best friends are psychiatrists.
Yeah, I love psychiatrists. They're great. My dad's a psychiatrist. So Dr. Arma's a psychiatrist. I mean, I love psychiatry. But, if we're truly to generate solutions, right, about our patients that we see, they don't just see a psychiatrist. In fact, most of them will never see a child psychiatrist like me. And so I wanted to hear from people who are patients, who are, so there are youth that attend these conferences as well, that are in this age group. I wanted to hear from mothers who have had children that they have taken for mental health care. And I wanted them all to understand what happens when a Black child comes to the hospital and sort of break it down in a way that's very digestible. And, people like stories. I mean, everybody likes a good story. I think storytelling is so powerful, and it brings people into the world of psychiatry because people don't know what happens inside. I mean, psychiatry is somewhat of a mystical field. People don't even really know the difference between a psychiatrist and a psychologist. So it's important to really break it down and bring them into the eyes of mental health professionals to say, at the end of the day, we're here because we want to take care of Black children, and here are the things that we're seeing that make us concerned. And I can say that, but to show you that with a story, I think is just so powerful. And I think it's resonated with so many people from, there have been policymakers who have attended. There have been people who, are, like I mentioned, are teachers, principals, clergy. So I just think we're going to need a multidisciplinary approach, and we need the expertise from our patients and families if we're going to move the needle on this.
And if I can just say, the power of these sessions is incredible. I've tried to attend every session that happened, even if I had to be in 2 places at one time at one point, because that very first one, the over 300 people online, there were people in person. Listening to the stories really brought the human side of what is happening from the patient's perspective, right? So not only does Amanda bring out what the provider was experiencing and what they saw and their challenges and struggles, but she also brought out what the children had to say and what were their words in quotes. And when I tell you, I don't think that there anyone who could have listened and not had some tears in their eyes about what was going on. And I know I did. And I deal with this every day and have done so for, over really now over 2 decades, right? And it brought that to me. So I think that's the piece that's important, that allows people to really recognize what's happening when you can hear it, that human piece of it.
Mm-hmm. Well, let me ask you each to answer this question. And I have a pretty good sense the first answer is no. Is the mental health field, as it's currently set up, equipped to care for Black children? And if the answer is no, and happy to hear if that's the wrong answer, but if the answer is no, what are the levers that we need to press to change things? What specifically do you think needs to change when we think about the whole mental health field? And Dr. Arma, why don't you start and then we'll move on.
Sure. Thank you. So the answer I would say right now is no. I think that efforts like what Dr. Calhoun is doing, those are the kinds of efforts that can move the needle forward. Because I think oftentimes over the course of the years, we've really, as Amanda said, Dr. Calhoun, as you said, really, it wasn't necessarily a receptive environment to help people to learn what needs to be learned so that we can give better care. Oftentimes, children are being misdiagnosed, underdiagnosed, over-pathologized. All of those things are happening, and this is not news. This is what we learned back when with the unequal treatment, the Institute of Medicine's report that came out when I was going into medical school. Lots of, if not all of what was going on then is going on now. People are not getting adequate care, and it's unequal, and race is a huge factor. I would say, one, the conversation needs to happen. And then we also need to think differently. If we think about how our fields were created, they were created not with Black people in mind. And so we do have to look at what necessarily relates to some of our cultural norms and our roots. How are we doing things? We're very sort of social, right? Community was so important in the Black community. But to say, okay, you're just going to go to this one person who's not from your community and you're going to tell them all your deep, darkest secrets when you can't even trust your next door neighbor who doesn't look like you is far-fetched. So being able to help people learn how to give more culturally humble care and to be able to relate to their patients, I think is a huge factor. I think there are a number of things we can do, but I think, again, to move that needle forward, things like what Dr. Calhoun is doing is really necessary so that you can end up having someone who treats you, who you can trust, who respects you, and has high expectations of what you can do and what your care can actually be.
Perfect. And Dr. Calhoun, I'd like you to answer the same question. What do you think needs to change, or what levers would you press? Are they in training and policy? In just attitude and approach, or any other levers that you would like to see pressed to change the way things are today?
Yeah, I think it's a great question. I'm also going to echo Dr. Arma and say no, not equipped to optimally care for Black children and youth. I think that it's I kind of think about it sort of as a double-pronged solution. So yes, education, and I think being able to understand what even is culturally responsive care is important. And I think you need to first understand how do experiences of anti-Black racism impact the mental health of Black children? I mean, right now, there's no standardized medical education that teaches you that, as a trainee, as a healthcare professional. And I just think if you're in the mental health field and you're going to be caring for Black children, that training should be mandatory. So as far when we think about policies, ACGME and a number of leading national medical organizations recently came forward last week in support of DEI policies in medicine and healthcare. So we need more than that. We also need, mandated training and education. And I think the other side of it is also accountability. So as I mentioned, it's not safe right now to report when racist behavior is happening, largely in medicine. So people are afraid, so people are afraid to come forward and report these things. And there's little to no protection when you do report these things. And so we need a robust reporting system that actually is well staffed by a group of experts who are trained in anti-Black racism, who are trained to look out for what does retaliation look like after you report a racist incident, who, so that people actually feel like they can come forward and have a voice. Because even though, a recent Commonwealth Fund report came out, I think it was in February, or that basically said that nearly half of healthcare workers have witnessed racism inflicted on patients. The other half are saying they didn't see it. And some people in healthcare still don't believe racism is a problem. And so you've got people who are saying, I'm seeing this a lot, it's a problem. And then you have some people saying, well, I think it's great. I think we're doing great. And so that therein lies the problem. So for you to take a stand and say, I don't agree with your behavior, you have to sort of confront your colleagues. And I think for many people, that's very scary, and it doesn't come without risk. And in medicine, we don't really create a space where we can do that.
Well, speaking, I want to talk to Dr. Arma about confronting your colleagues. And I want our listeners across the country to know that among your many accomplishments, and there are many, is that you really highlighted racial disparities in mental health, physical health, back in 2011 as an American Psychiatric Association Yale Minority Fellow. And this was at a time when many continued to deny these gaps existed. Talk a little bit about the resistance that you faced in the past, and why has it not improved?
Yeah, thank you. And I think that tying into one of the things that probably should also be said with the last question, I'll tie it into this question,
Sure.
Which is that one of the other pieces that needs to happen is that we have to have more of us in the mental health field that are Black. If we're seeing this racism against Black children. And that's why experiences like the American Psychiatric Association having these minority fellowships is important. I was really happy to get a chance to do that. I didn't even know that it existed. A colleague of mine reached out a week before the application was due and said, Tishiana, this is for you. You need to go and do this because this is all the stuff that's important to you. And so during that year, I was able to get $40,000 that helped to do things like bring Dr. David Williams, who is a huge voice in the mental health care disparities dialogue, and is prolific writer. I think maybe Amanda's only second to Dr. David Williams in prolific writing. But in that, I was able to take an opportunity to set aside time to learn for myself about the mental health care disparities, and then also some of the extra layers, uncovering bias and being able to teach my own colleagues. At the time, we didn't have a really formalized system or didactic around what was happening in healthcare, all these racial disparities. And so, Dr. Rohrbaugh, who was our then program director, said, hey, Tishiana, why don't you teach it? Go learn it and teach it. And so I taught it to my fellow fourth years as well as our second years. And what grew from that as I left and just would help to support the other residents teaching residents was a growing system of looking at healthcare disparities, looking at social equity and social justice. And what grew from that was a small group of professors who were all able to come together and say, okay, what does this look like all throughout the years of Yale residency? Where are we looking at social justice? Where are we looking at health equity? Let's bring it together. Let's make it cohesive. And now they have an entire social justice and health equity track. And
I I want to just talk a little bit about the numbers of psychiatrists, psychologists we have. And Margaret, you remember we had Dr. Lewis Sullivan on, former HHS secretary. He told us the story that back in 1950, when he started medical school, there were 2% black residents along with himself, and that today there were 5%. And, you know, the American Psychological Association report found that only 4% of psychologists in the United States were black, even though black people represented 13% of the population. A similar disparity exists among social workers and psychiatrists. Dr. Arma and Dr. Calhoun, I wonder if you could share with us your role in training that next generation of mental health care providers, especially efforts to involve all communities.
Yeah, so I can start. So, you know, as a fellow still, it's kind of funny to me to think that I'm mentoring others, but I've had a lot of, you know, medical students and undergraduate students reach out to me, wanting help, wanting support, wanting encouragement. I think it's a heavy burden to bear to go into medicine as a Black American. It is, especially because the younger generation, which I'm so glad about, is more and more aware of what they're getting into and the racism that exists. And so for me, taking out the time to mentor people who want to come into medicine, encouraging them to come into psychiatry, and letting them know that it's okay to take a break and care for yourself, and make sure that, you know the burden that you're taking on, but at the same time, how much needed you are. So I think that for me, really, mentoring others, and also, programs like what Dr. Arma mentioned. I also was in the Minority Fellowship Program. So, going back, I'm supposed to go back and speak to current Minority Fellows in SAMHSA about their experiences and my experiences. So I try to carve out time to speak to future physicians and really encourage them, especially Black physicians, to to stay the course, because we really need more Black physicians. We really need more physicians, period, who are compassionately and empathetically caring for Black people. So I also carve out time to mentor people who are not Black, but have read about my work and want to know, I don't want to perpetuate racism. I don't want to be part of that. I want to take a stand and be different. I want to be an ally. I want to support you all. And so for me, taking the time to show it, to tell them, you don't have to be Black to empathetically care for Black children. You just have to be an empathetic person that takes the time to learn and unlearn the things that you have learned in this country. And so for me, taking out that time to speak to those people, I think means a lot to me, and I hope means a lot to them as well.
Well, I'm sure we're running out of time here, but I got to get a question in about research. 3 years ago, the National Institute of Health issued a public apology for, quote, structural racism and biomedical research. We know that we need research. We know that research is key to unlocking answers and changing the future. But I'd like to ask each of you to just maybe comment briefly. Are we making progress in dismantling structural racism in research?
There are some optimistic parts to that. So I will say, we have seen a little bit of an improvement in sort of seeing who's getting some funding, but then we also have seen dips as far as who's getting funded. So right now we know that Black researchers, researchers who doing work into health disparities are less likely still to get funded. And then if you think about across generations, because it's been difficult to get funded in the past, if you're a young researcher who is trying to research health disparities, your mentors, first of all, you may not have a mentor around you who's doing that work. And second of all, if you do, they have less money because they were less likely to get funded. So that impacts your work. So for me specifically, my research is in the mental health effects of anti-Black racism in children. And I really had to pull, Dr. Arma knows this because she's one of my mentors, but I had to pull mentors who didn't necessarily have NIH funding, quote unquote, because, they should have NIH funding, but, they weren't able to get it, or, they decided they didn't want to go down that route. But I had to pull mentors who had expertise in the field beyond that. And I did receive NIH funding, actually. I received the Loan Repayment Program Award. But I have a lot of concerns about whether I will continue to be funded, because based on, what we've seen, it's very difficult to be funded as a Black person, and especially a Black person who's studying racism. So I think we have a long way to go.
I think that what we have to think about is, everything that Dr. Calhoun said is spot on, and that's at the far end. There's a much earlier point in which we have to address it, right? So we have to create opportunities and exposures at youth, especially for folks who are Black, because we were talking about just the low levels. It should be at least 14, at least 10%, right? Who are Black residents, who are the people who are going to be seeing the patients, who are going to be doing the research. So you've got to give them the exposure to the research early on. There are all these wonderful programs, and oftentimes they're only available to small swaths of the community, sometimes only the lowest of the lowest of the lowest income, but there's a larger. We're not monolithic as Black people. So we really have to make opportunities available to the youth so that they would even be going down that path to ever end up in the point where they're applying for this funding. So that's what I wanted to point out.
Do we have time for one more question or time to close?
Unfortunately, I think they're giving us the hook, but I did want to just acknowledge the leadership that Dr. Arma has played in telepsychiatry. And her advocacy around not only in the state, but across the country to make sure this vital service exists. And we want to thank her for that.
Thank you so much. It's another matter of equity. So we definitely need to keep the eye on that.
Well, Dr. Titiana Arma, Dr. Amanda Calhoun, we so appreciate you joining us on Conversations. And thanks to our audience for being here. Please be sure to subscribe to our videos on YouTube. Find us on Facebook and X with our account name, CHC Radio. As always, you can go online to chcradio.com to sign up for email updates. And please share your thoughts and your comments about this program. Thank you both so much for joining us today.
Thank you for having us.
This copyrighted program is produced by Conversations on Healthcare and cannot be reproduced or retransmitted in whole or in part without the express written consent from Community Health Center, Inc. The views expressed by guests are their own, and they do not necessarily reflect the opinion of Conversations on Healthcare or its affiliated entities.